Well, my guest tonight is the Chairman House Committee on Healthcare Services, Honorable Tanko Sununu. Honorable, welcome to Politics Today.
Thank you very much for inviting me once again.
I just want to find out quickly from you, as Chairman of the House Committee on Healthcare Services, since the second wave, I know the National Assembly is on recess, but what level of engagement have you had with the PTF on the rising numbers so far?
Well, thank you very much. Let me say, even though we are on recess, you can see I'm right now in Abuja. I just came back from my constituency. Prior to when we, just 2-3 days before we closed the house, we had an oversight function, and we went to the PTF office, and we were fully briefed by the chairman of the Presidential Task Force, who also doubled as the Secretary of the Government of the Federation. He told us what they have so far been doing, the challenges, and we rub up mind to see how we can address some issues. Part of the success story we are informed, of which I also try to physically assess some, is the fact that when we started, initially, we only have 4 laboratories that are functional. But as of today, we have over 100 laboratories distributed nationwide that can effectively diagnose COVID-19. And also, not only that, when we came, we had very few isolation centers and ICUs in the country. As of today, government and non-governmental organizations that came together, we can say we have multiple isolation centers that are functional. Earlier, before that, you also have to know that the country was just taken unaware, just like the world over. And it has tested the capacity of the country and the world over to see how the resiliency of our healthcare delivery. Nigeria was also not left about. What we noticed at that initial, the first wave, was that we lack resiliency in the sense that common diseases that are known, that are chronic, people suffered in where they can go to get attended to. And that added much to the morbidity. And in some states, you find that because of the lockdown we had there, and there is that fear of nosocomial acquiring disease in the hospital, people stop themselves from going to hospital. Physicians are also scared of how to approach disease, being a novel disease at that time. But that gradually has winded up, and we have now confidence in the this, and we also in the management team. We also have to know that even though we have the second wave also came with a special feature. One of these special features, the virus shows that it's more virulent, and then it affects especially those with comorbidities, like those with diabetes, hypertension, or chronic bronchitis.
Are you talking about the new variant of the virus?
Yes.
But it hasn't been clearly stated that has been discovered in Nigeria yet.
No, that means what I'm saying, that the second wave itself came with that. The nature, the aggressiveness of the first wave is less than that of the second wave.
Why do you think that is so? Are there certain actions or inactions that could be responsible for the rising numbers of the COVID-19 cases in the country?
Yes, it couldn't be said an inaction or this is so to say. You should know that prior to second wave, economy was so battered, transportation was disorganized, everything was almost going down. But then gradually, when the world succeeded in trying to flatten the curve, people thought, this is time. Economy has to be open, school has to be open, and all this are there. And you cannot continue to sustain that lockdown, especially here in Nigeria, that a lot of us have to go out and work for what they are going to eat tomorrow. So when you sustain that lockdown, it becomes a problem. Now, as we are going, the country economy is open up, and then there is increased traffic rate in terms of going in and out of the country. And then with coming of the news variant of the virus itself in some developed countries, especially the UK, when you see that most of the destination of Nigeria is Nigerians, is usually UK, en route to other countries or specifically going to UK. So that can also explain the number of this. And then the other issue is that a lot of people will not, some of them will refuse to submit themselves to 7 days post-arrival COVID tests so that we can know who are those abhorrent organisms. You understand? Because you may be a carrier arriving today, but because you have not developed symptoms, you are within the incubation period, the airport screening may not be able to detect you. And that's why you are advised to go and isolate yourself, and then you report to the to the centers where you can get screened after 1 week. A majority will not. And then Nigerians too are not good in keeping themselves Even in the US, you find that the number of deaths among black is high because black have tendency to go to business relation, social gatherings, and rest.
That's why I asked the question of what actions or inactions could be responsible for this, because clearly you've talked about the responsibility on the part of Nigerians who have come into the country and failed to submit those tests or submit themselves to self-isolation. However, many have questioned why there is no means of, actually containing the people who have come into the country, or at least tracking those who have refused to submit those tests and taking appropriate action. Yes, the immigration has released the list of Nigerians, the passports of those who have been placed on ban. Do you think that has helped?
Well, that will have helped because it shows that the country is also ready to handle the issue aggressively. If a businessman is barred from going out of the country, it's a lesson to his neighbor that, look, if you go, you must subject yourself to the country's rules and regulation. Otherwise, your business will suffer. Some of them are a lot of international businessmen. You understand? So the little we are putting will actually impact positively. But the major issue is that that's making it worse as of today now. You have mentioned it in your remarks when you are trying to give the background analysis. We are still in a situation where a lot of Nigerians do not believe that COVID exists. It's only those who lost one of their close relations and rest that believe that it exists. People thought it is a way of trying to frighten the country or trying to find a way of trying to siphon government funds and others. These are all accusations that people do tell us in our constituency that this is existing. But the actual fact is that COVID is a reality and it's existing.
We do know that. But would you blame Nigerians considering the attitude of governments? For example, the National Identity Card registration process that many have called for cancellation. Yes, the National Assembly is on recess, but many would have expected that at this stage, the National Assembly would have waded in. We've heard nothing from not even the leadership or the Health Committee on this issue.
A point of correction. In the House, it was raised as a motion of urgent public importance. It was debated.
No, just a second. Yes. I think you're missing the point. It was raised in the House before the process commenced.
Yes.
The call was for an extension. That extension was granted, not as much as the House wanted it. However, since the registration commenced, there have been large crowds gathering at NIMC offices, which a lot of people have complained about. Even the staff of NIMC have claimed that some of them have caught COVID from those crowds. Yet we've not heard anything about it from National Assembly, at least not the leadership or the health committees of the National Assembly.
No, I think there was a time we were being trying to pass measures, especially through my handle and rest, to call people on to be safe. But you see, actually, I quite agree that there's need for government to not say just 6 months. Because the issue is that once you give time, Nigerians have the tendency not to go until last-minute rush. You understand? We can simplify it in such a way that other avenues can be created. So the government can subcontract this registration to different organizations that can do and assist. All you know is to have a central data where the data of everybody can be pulled together. We have done so with the BBN, and then they are also married together. So I think what is needed is for the government to increase the number of centers that can do that. Accredited, give them a standard criteria that they will follow, and don't admit more than 3 people per time. You understand? But when you say a state have to go to one particular center to this, definitely, communication is very vital, especially at the time of insecurity. Nobody would want to lose his line because he cannot get his NIMC attached to his...
So would it be a fair call now to say that until that is done, the process should be suspended, at least to show those who are doubting? Because many people have concluded that if the government which claims that the COVID-19 is real in the country, is exposing Nigerians to something like that, then why should they obey it? So the calls possibly put a suspension to this while more centers are created, and then the process can continue.
Definitely, that's. I think as soon as we resume, or even before then, I'm sure that the House leadership will seek the advice of the chairman of the Committees of Affairs of the National Assembly, of which even yesterday we had a meeting with the Senate counterpart, and we have reviewed the situation. Definitely, it's exposing a lot of risks to the country. And then the benefit, now we have to look at it, the benefit of doing that, and then the risk of getting people exposed more to the virus. We will have to weigh it. And not only that, it's also trying to, when we continue to do it in such a manner, it also tends to put doubt on the minds of people, and therefore may also lead them to not obey the protocol that we are trying to call people to adhere to. So definitely government has to take a position.
Very well. Let's sit with government attitude to this now. There have been hints of a second lockdown. Many have questioned if that's necessary from your assessment. And I believe that from your engagement with the PTF, you'd have an answer for this as well. How effective was the first lockdown? And do you think a second lockdown is necessary? Will it help?
See, if you say how effective it was, the first lockdown, I can't say it was 100% effective, because you have to look at the circumstances that an average Nigerian found himself. I just mentioned earlier that people have to go out and look for what to eat tomorrow for today. You understand? And then our social package and social welfare services is also still at rudimentary stage. You understand? We have a lot of many vulnerable groups that need to be taken care of. You understand? But you see, rather than putting absolute lockdown that will affect the economy, affect the psyche of Nigerians, and then came with an aftermath, just as we have seen in the first lockdown, we should try to see how we can engage stakeholders. If you look at it, Nigerians were always we are good in denial. When the government says, and the World Health Organization says that it's polio, people try to say no. And a lot of it became a serious issue. What the government did, it resulted to creating community headed by traditional rulers, headed by religious organizations, preaching to people until people now realize and accept it as a reality that it's not something trying to do otherwise to their health or to their fertility and rest. You understand? And it became acceptable, and today we are proud to say Nigeria has eradicated polio in the country. So that formal setup is still there. So I think the PTF will have to reactivate that avenue that was used by National Primary Health Care Development Agency to achieve eradication of polio, so as to strengthen the fight against COVID-19.
Okay, now you are a health professional. Okay, now some would say that till now we haven't found ways to deal with this virus that are peculiar to us in Nigeria. Some have raised the issue of the symptoms of COVID-19 are similar to malaria and typhoid. So why is it that at this stage we still haven't found a way to deal with issues with the COVID-19 pandemic that in ways that are peculiar to us? We've heard from high places, even the governor of Kogi State referred to the actions of the federal government as a copy and paste, insisting that we must deal with the virus if it does exist, according to him, in ways that are peculiar to us.
Yes, I quite agree with you, but then generally we must know that viral diseases and virus infection are not like bacterial infection. That you can say straightforward, this is a bacterial infection, pneumonia, caused by streptococcus, give it antibiotics to go clearly. You understand? Virus have their own peculiarities. Antiviral are not only costly, but they also take longer time too. You understand? And then, unlike bacteria that you can culture in your lab, to say that this is, you can do microscopy, culture, and sensitivity to find which particular organism it is responding to. On virus, unlike that. Even the remdesivir that are this thing, just now, the World Health Organization of recent says it's amount waste of money, it's costly, and it doesn't add value to this thing. So mostly in viral diseases, treatment is usually supportive to boost body immunity so that body can be able to fight it on its own. And then that calls for what? Early detection, early presentation. When you say that, yes, there are similarities, and that's why we are trained as doctors to have differential diagnosis. That, look, this can be chest infection. It could be pneumonia. It could be viral. It could be all this. Now you have 5 different different diseases that you think. And you now try to find which one is deadly by trying to type.
Okay.
And where you can have access, where you cannot differentiate, you go to the lab and find the solutions.
Okay, let's go to the issue of the vaccines now. It's not clear who will pay for these vaccines yet, as no budgetary provision was made in the 2021 budget. And it's really worrying that Nigerians are beginning to question whether the federal government is really committed to vaccinating all Nigerians as is expected. As a lawmaker, does it worry you that you don't know where the money for the vaccines will come from?
You see, we have to differentiate the 2 sources of vaccine that we are talking now. The first source is the global donation to the countries, of which Nigeria is going to receive about 100,000 doses.
Which doesn't cover the entire
it doesn't
country.
cover the entire nation. But you see, government have way of provisions. There are a lot of provisions that can be utilized under service-wide board. You understand? And then thereafter, we follow it up to see how the government will now come up with a modified. If you look at the 2020 budget, the COVID expenditure wasn't in the initial provision of the 2020 budget. But then the federal government quickly came up with the revised budget bill that was passed to the National Assembly. The National Assembly discussed it, deliberate on it, and then pass it as a revised amendment budget. You understand? So there is that possibility for government to also do similar this thing, because these are unplanned for.
But then how's the National Assembly going to monitor the vaccine administration process, the distribution process? Because there are fears now that, despite the fact that the PTF has said that when the vaccines come into the country, that the frontline health workers will be the first to get those vaccines, there are fears now that the rich and political elite will benefit more. As lawmakers, it's your responsibility to monitor processes like this. How is the National Assembly going to go about it?
It's just like what I told you. We had that meeting of the Health Committee yesterday, chaired by the National Assembly Committee on Health, chaired by the Senate Committee on Health, chairman. We quickly came back so that we can quickly sit down at this thing. And within the next 48 hours, we are going to invite the PTF, especially the National Primary Healthcare Development Agency, who have the mandate to vaccinate or to vaccinate people in the country. We want to hear their modalities so that where we are in disagreement, based on the information we have from our various constituencies, we are going to check at this. The National Assembly, let me tell you this thing, is not a rubber stamp National Assembly. If you want to find that, go and check between proposal of 2020 amendment budget and the 2020 Amendment Act. You find that there are a lot of provisions that came from the executive that we at National Assembly, we didn't accept that can translate into benefit to our entire nation. For example, there was a provision of 3 molecular laboratory per each geopolitical zone in the state. You understand, each of the 36 states of the Federation and FCT. Now, the question we raise at National Assembly, yes, quite all right, it's needed. But then, is it going to be effective? Okay. Who will monitor the labs? Who provide manpower? Are states ready to take over from the federal government? And we said, if that cannot, then it's better we try to upgrade our existing laboratory in our tertiary institution. All right, Honorable Sununu. And if you go there, you see a lot of things.
The issues of transparency as far as this is concerned is very much important, and it's something I think we'll sit on. But let's take a break and we'll be right back. But I understand that it's time to say goodbye to you. I had a good conversation with you. I thank you very much for finding time to come speak with us. Honorable Tanko Sununu, Chairman House Committee on Healthcare Services. Thank you very much for your time.
Thank you very much, sir.
When we come back, we'll look at improving the country's security situation. Please stay with us.